I want to talk about something that a lot of women in their 40s are dealing with privately, silently, and often alone, because nobody in their life has ever said the words out loud. Vaginal dryness? I said it. And I'm going to keep saying it clearly, specifically, and without a single euphemism, because this is a medical symptom, not a secret. And it affects up to 50% of perimenopausal and menopausal women. That's half of us. Half. It causes burning, itching, pain during sex that can range from uncomfortable to genuinely unbearable, urinary urgency and recurrent infections, a sense of rawness and irritation that can be present every single day, not just during intimacy. And because nobody talks about it openly, millions of women assume this is just what getting older feels like, that there's nothing to be done, that they have to manage it quietly and get on with it. In this video, we are going to cover everything you need to know and everything you need to do. We're going to start with why this happens, because understanding the cause changes how you approach the solution. Then we're going to go through your actual options, from the most accessible over-the-counter approaches all the way to the medical interventions that are safe, effective, and that your doctor may not have brought up. Then I'm going to walk you through a pelvic floor exercise sequence specifically designed to improve vaginal health and reduce discomfort. And we are going to talk about intimacy, honestly, specifically, practically, because your sexual well-being is part of your health, full stop. Let's talk about what is actually happening in your body. The vaginal tissue, the vulva, the urethra, and the bladder are all densely populated with estrogen receptors. Estrogen keeps this tissue thick, lubricated, elastic, and healthy. It maintains the natural acidity of the vaginal environment, which protects against infection. It supports healthy blood flow to the region. It is essentially the maintenance system for your entire pelvic floor. When estrogen declines in perimenopause, and remember this decline can begin as early as your late 30s, that maintenance system starts to wind down. The vaginal walls thin, natural lubrication decreases, the tissue becomes more fragile, less elastic, and more prone to irritation, tearing, and infection. The vaginal pH rises, making the environment less hostile to harmful bacteria. This constellation of symptoms has a clinical name, genitourinary syndrome of menopause, or GSM. It used to be called vaginal atrophy, which is a terrible clinical off-putting name that has thankfully been updated. GSM is the preferred term now. And it matters because it correctly encompasses not just vaginal symptoms, but urinary ones too. The urgency, the frequency, the recurrent UTIs that many perimenopausal women experience. Unlike hot flashes, which often improve over time, GSM symptoms tend to get worse without treatment. This is the one symptom you absolutely do not want to wait out. The good news, and there is genuinely good news here, is that GSM is one of the most treatable conditions associated with perimenopause. The options are excellent. Let me walk you through them. Your options fall into 3 tiers: over-the-counter non-hormonal options, prescription-only hormonal options, and lifestyle and complementary approaches. We are covering all 3 because the right combination is individual and you deserve to know what's available before you decide. Vaginal moisturizers. These are your first line of defense and your daily maintenance tool. Unlike lubricants, which are for use during sex, vaginal moisturizers are applied regularly, every 2 to 3 days, and work by replenishing moisture in the vaginal tissue over time. They are not a quick fix. They are a sustained intervention. Look for products that are water-based, fragrance-free, and pH-balanced for vaginal use. Brands like Replens and YesVM are widely recommended by gynecologists. These are available without prescription and can make a significant difference if used consistently. Lubricants for intimacy. A good lubricant is not an admission of failure. It is a practical tool that makes sex comfortable and enjoyable, which is your right at every age. Choose water-based or silicone-based lubricants. Both are safe with condoms. Avoid anything with glycerin, which can disrupt vaginal pH and promote yeast infections. Avoid anything with fragrance, flavoring, or warming or cooling agents. These irritate already sensitive tissue. Simple, clean, unfragranced. That is what you want. Local vaginal estrogen. This comes in the form of a cream, a pessary, a ring, or a tablet applied or inserted directly into the vagina. Because it is applied locally, directly to the tissue that needs it, the systemic absorption into the bloodstream is extremely low. We are talking about levels that are clinically considered negligible. This is not the same as systemic HRT. Local vaginal estrogen has a completely different and considerably safer risk profile. Local vaginal estrogen does not carry the same risk considerations as systemic HRT. It is safe for the vast majority of women, including many who cannot take systemic hormones. Vaginal estrogen creams such as Premarin cream or Ovestin is applied with a small applicator directly to the vaginal tissue. It is typically used more frequently at first, daily for 2 weeks, and then reduced to twice a week for ongoing maintenance. Results are typically noticeable within 4 to 12 weeks of consistent use. Vaginal estradiol tablets or pessaries, such as Vagifem or Invagus, are inserted directly into the vagina using a small applicator. Many women prefer these to cream as they are less messy and the dosing is very precise. Same regime. More frequent at first, twice weekly for maintenance. The vaginal estrogen ring, S-string, is a small, flexible ring inserted by a healthcare provider and replaced every 3 months. It delivers a very low, continuous dose of estradiol directly to the vaginal tissue. Many women find this the most convenient option as it requires no daily or weekly attention. Ospemifene, sold as Asfina, is an oral medication that acts as an estrogen agonist specifically in vaginal tissue. It is a non-hormonal alternative that can be prescribed for women for whom estrogen products are not appropriate. It requires a prescription and a conversation with your doctor about suitability. The critical message: if you are experiencing GSM symptoms and you have not yet had a conversation with your doctor about local vaginal estrogen, please have that conversation at your next appointment. Ask for it by name. It is safe, it is effective, and it is profoundly underused because women are not told it exists. Tier 3. Lifestyle and complementary approaches. These work best as complements to the above, not replacements for them, but they matter. Hydration genuinely matters for mucosal tissue health. If you are chronically underhydrated, and many women are, your vaginal tissue feels it. 8 glasses of water a day is not a wellness cliche in this context. It is relevant physiology. Avoid known irritants. Soap, shower gel, bubble bath, douches, and scented products anywhere near the vulva. The vulva is self-cleaning. It needs water only. Anything else disrupts the pH and makes symptoms worse. This includes many feminine hygiene products marketed specifically at women. Most of them do more harm than good. Regular sexual activity, including solo, maintains blood flow to the vaginal tissue and supports tissue health. This is documented in the clinical literature. It is not a lifestyle suggestion, it is physiology. Use it. Now I want to take you through a pelvic floor exercise sequence specifically designed for women experiencing GSM symptoms. This is not your standard Kegel video. These exercises target pelvic floor strength, flexibility, and blood flow, all of which directly support vaginal tissue health. A quick note before we begin. If you are experiencing significant pelvic pain, prolapse symptoms, or you have been told you have a hypertonic, overly tight pelvic floor, please work with a pelvic floor physiotherapist rather than doing unsupervised strengthening work. Some women need relaxation exercises, not strengthening ones. If you are unsure, A single session with a specialist will tell you everything you need to know. For the majority of women with GSM, this sequence is safe and beneficial. Let's go. Before we contract anything, we breathe. Place one hand on your belly. Inhale slowly through your nose. Feel your belly and your pelvic floor soften and drop downward. Exhale, feel them gently lift. This is the baseline. Your pelvic floor should move with your breath like a hammock. If you've never noticed that before, that's okay. You'll feel it now. Contract your pelvic floor. Think of lifting an elevator from the ground floor upward. Hold for 5 seconds, then release completely. That release, that full letting go, is what most women skip, and it is what matters most for elasticity. Do not tighten your glutes or hold your breath. Just the pelvic floor. 10 reps, 3 sets. Now we train the fast twitch fibers. These are the muscles that respond when you sneeze, cough, or laugh. Contract and release quickly, not slow and held fast. 15 quick flicks, rest. 2 more sets. This is what addresses urgency incontinence. Hold on to a door frame or the back of a sturdy chair for support. Lower yourself into a deep squat, feet wider than hips, toes turned out. Let your pelvic floor fully release in this position. Breathe. This is a stretch and a blood flow exercise. You should feel a gentle opening sensation. Hold for 45 seconds. This is one of the most underrated exercises for pelvic floor health and vaginal tissue circulation. Lie on your back, knees bent, feet flat. Drive your hips to the ceiling, and at the top of the movement, add your Kegel. Contract the pelvic floor, hold for 2 seconds, then release as you lower back down. This integrates pelvic floor work with glute activation, which supports the entire pelvic girdle. 12 reps, 3 sets. This one is doing multiple jobs simultaneously. Do this sequence 3 times per week. Results in pelvic floor strength and symptom improvement are typically noticeable within 6 to 8 weeks of consistent practice. I want to spend a few minutes on intimacy specifically, because this is the dimension of GSM that causes the most quiet suffering and the one most likely to go unaddressed. Pain during sex changes things. It changes how you feel about your body. It changes how you feel about intimacy. It can create anticipatory anxiety. You start dreading something that used to bring you pleasure, and then you start avoiding it. And then the avoidance creates distance, and the distance creates its own problems. This cycle is real, it is common, and it is not your fault. Pain during intimacy is a medical symptom. It is not a message about your desirability. It is not about your relationship. It is a symptom, and symptoms can be treated. Here is your practical intimacy toolkit. First, communicate. I know that sounds simple and is anything but your partner, if you have one, cannot support you through something they don't understand is happening. You do not have to use clinical language. You can say, "My body is going through changes and sex has been uncomfortable. I'm working on it. I need us to go slowly and I need you to be patient." That conversation protects the relationship. Silence damages it. Second, extended foreplay is not a luxury. It is a medical requirement right now. Arousal increases vaginal blood flow and natural lubrication. More time means more comfort. This is physiology, not preference. Take the time, communicate that you need it. Third, experiment with positions that give you more control over depth and angle. Women on top positions are consistently reported as most comfortable for women experiencing GSM because they control penetration depth. Side-lying positions also reduce pressure. Positions with deep penetration may need to be modified or temporarily set aside while treatment takes effect. Fourth, use lubricant every single time. Not occasionally, every time. It is not an admission that something is wrong. It is a tool that makes sex comfortable. Apply it generously, apply it to both partners, and reapply if needed. There is no award for toughing it out without it.